Hi folks, Dr. Torres here. Hope you're all doing well, enjoying the summer. Last time we discussed the topic of finding and resolving our patients' concerns, and we discussed a magic question, which is, do you have any other questions or concerns? I hope that you're using that technique, as it is fundamental to improving the patient experience. If you have not had a chance to look at that brief video, you can look through your email for last month's mock code and just take the couple of minutes to review that concept. Today we're going to be talking about a technique called blueprinting. Blueprinting refers to laying out a plan before you build something. Like when you build a house, you have blueprints so that we know what's going to go where and what's going to happen. So blueprinting, when it comes to the patient visits, essentially is a way in which we explain to our patients what is going to happen during their visit. You have to remember that most patients have never been to an ER before, or they rarely go to the ER in most cases. And they are unfamiliar with what goes on or who is caring for them. Letting them know what is going to happen helps to alleviate and decrease the anxiety associated with the visit. Okay? So with blueprinting, we explain to them as a brief summary what is going to happen next and what the plan will be before you go and see them back before discharge. Let me give you an example of how blueprinting works and how we apply it to a patient visit. After getting the history and examining the patient and asking them if they have any questions or concerns, we can explain to them, for example, okay, this is what is going to happen. Mike, our ER tech, is going to start an IV and draw some blood work, while Patty, our nurse, is going to hang some fluids and give you some medicines for your nausea and to bring your fever down and to treat your pain. Then Jenny, our radiology technician, is going to come in the room and take you across the hallway to get a CT scan, as we discussed. And then we will sit down again after all those examinations are done. When we blueprint the visit like this, the patient has an idea of what is going to happen and what to expect. You can also give them some reassurance that they can ask us some questions at any time, because sometimes things get busy and they may wonder, did they forget about me? What is happening? Where are we in the process of the visit? So I usually use a little phrase that goes something like this. Sometimes things can get busy around here. That does not mean we have forgotten about you. Here is your call button. In case you have any questions, you can ask us anytime. Just press your call button and somebody will be in here. If you're in pain or you have new symptoms, just ask us questions if you have any worry anytime during the visit. Something simple like that. As you have seen, making these statements takes maybe 30 seconds. And it's a nice way to kind of leave the room after you've had the initial encounter. And that way they know, okay, I know kind of what's going to happen. I know I can ask questions. I know what the call button is for. If I have any symptoms or if I have any additional questions. Apparently the doctor tells me sometimes things get busy, and that doesn't mean that they've forgotten about me. And always remember, before you leave the encounter, anytime you go in the room, do you have any questions or concerns? Communication is key when we're dealing with a complex situation like being in an emergency department encounter. Anyways, that's the tip for the month. Really appreciate all you guys do. It is a special line of work that we have chosen. Remember that medicine is a team effort. Always be mindful not only of your patients, but also of your work colleagues. Going the extra mile to help each other lessens the work burden and builds our camaraderie and team spirit. Thanks for choosing to work in healthcare. You have chosen a vocation that is extremely meaningful and that provides comfort and relief to many. Until next time, have a great month and be safe.